Hello, this is our public service announcement on cocaine is a drug created from a paste extracted from the leaves of the South American coca plant. Although healthcare providers can use it for valid medical procedures, such as local anesthesia for some surgeries, recreational use of cocaine is illegal. It is a gateway drug that is highly addictive. People snort cocaine powder through the nose, or they rub it into their gums, and others dissolve the powder and inject it into their bloodstream. Cocaine increases levels of the natural chemical messenger dopamine in brain circuits related to the control of movement and reward centers. Cocaine can cause long-term damages in the brain's reward circuit and other brain systems, which may lead to addiction. The reward circuit eventually adapts to the extra dopamine caused by the drug, becoming steadily less sensitive to it. As a result, people take stronger or more frequent doses to feel the same high they did initially and to obtain relief from withdrawals. The drug creates a strong sense of exhilaration. Users generally feel invincible, carefree, alert, euphoric, and have a lot of energy. This is usually followed by agitation, depression, anxiety, paranoia, and decreased appetite. The effects of cocaine generally last up to 1 hour. Some people find that cocaine helps them perform simple physical and mental tasks more quickly, although others experience the opposite effect. Large amounts of cocaine can lead to bizarre, unpredictable, and violent behavior. Cocaine's effects appear almost immediately and disappear within a few minutes to an hour. How long the effects last and how intense they are depend on the method of use. Injecting or smoking cocaine produces a quicker and stronger but shorter-lasting high than snorting. The high from snorting cocaine may last up to 15 to 30 minutes, and the high from smoking may last from 5 to 10 minutes.
There are many ways to have the drug in your body, whether it's by snorting it, smoking it, consuming by your mouth, or using needle injection. And with each different type of way you put it into your body comes a new different type of health problem. So when you snort it, you could lose your smell, you could have nosebleeds, runny nose. When you smoke it, you could have a cough, you could have asthma, respiratory distress, and higher risk of infection like pneumonia. When you consume it by your mouth, you can get severe bowel decay from reduced blood flow, and even when you inject the drug with a needle, there's a higher risk for contracting HIV, hepatitis C, and other bloodborne diseases. So there's a lot of long-term effects of using cocaine. It could be being malnourished because of the cocaine decreases your appetite, and even movement disorders, which include Parkinson's after using cocaine for many years, as well as weight loss. You can have stroke, mood disorders, memory loss, slow reaction time. And even when young people who are healthy, you'd be surprised that they'd be able to get heart attacks because of increased heart rate and blood pressure. So if one decides they want to withdraw from the drug, there's a lot of different symptoms, which can include depression, fatigue, increased appetite, unpleasant dreams and insomnia, and slow thinking. So there's also muscle weakness and depression even. So if you want to withdraw and you want to get treatment, there are many different ways you could do it. Either by having behavioral therapy, so the different types are like cognitive behavioral therapy, or contingency management, or motivational incentives. So like if somebody gets a reward for deciding to cut back on the cocaine, there are therapeutic communities which have basically like a rehab, so drug-free residents, they go and they recover. And there are also community-based recovery groups such as 12-step programs, so that those who want to get treatment can.